So good morning. I don't know who actually gave this title, something about confusion. I guess it's a good title, but I think Amy called it confusion, but I don't know. Anyway, it's a good title. But what I'm going to push here in the next few minutes is I think we have a problem in that we use different definitions for all sorts of things. I mean, the basic definition of parental alienation, we don't all have the same definition. So I'm going to push to try to use the same definitions for at least some of the things we talk about. And this handout is a chapter of the book that's coming out in a few months. It's called Parental Alienation, Science and Law. And this is actually not one of the main chapters. It's actually the appendix of the book in which we define the terms that we use in the book. That even though we have about 10 different chapter authors, we've encouraged the chapter authors in the book to use the same definitions, and then we'd like to promote it, among other authors. So I want to give you some examples of what I mean, and let's look at page 5. And so the particular thing I want to talk about first is what Amy Baker has helped develop, and that I've then modified a little bit, which we're calling the 5-factor model. So what is this? If you're in court and somebody asks you, how do you diagnose parental alienation? We need to have a somewhat consistent way of answering that question. In other words, you can't just say, oh, well, this is what I do. It would be nice to have some sort of standardized answer to that. And so one standardized answer is to say there are 5 factors. And if all 5 factors are present, it is extremely likely that this is a case of parental alienation. And let's just run down the factors. Factor 1 is the child, in fact, manifests contact refusal or resistance to having a relationship. That's sort of a threshold issue. If somebody says, does this child have parental alienation? It's a threshold issue. Is the child, in fact, avoiding going to visit the other parent? The second factor is that in the past, the rejected parent had a good relationship with the child. That is not as obvious in the literature on parental alienation, but it seems obvious when you think about it. Factor 3 is the absence of abuse, that the rejected parent does not have a history of abuse or neglect or severely deficient parenting. And of course, that's been a component of parental alienation ever since 1985 when Richard Gardner started talking about it. Factor 4 is the presence of multiple alienating behaviors. So those are the 17 alienating behaviors that we all know about from Amy. And but you have to be able to identify them. In other words, just because you have a child who's rejecting a parent, you have to be able to identify alienating behaviors if you want to make this diagnosis. And we get criticized. And I don't know if you're aware, I'm responding to lots of criticism that people accuse us of diagnosing alienation simply on the symptoms in the child. Or even better, they say that advocates of parental alienation claim that any child who rejects a relationship with a parent is manifesting parental alienation. That, of course, is idiotic, but people do say that, and that's why we spell out in these factors. And then the last factor, of course, is the 8 symptoms that generally occur, at least some of them generally occur, in alienated children. Now, when I've used this in court a few times already, and so sometimes people say, well, where did this come from? Who invented these 5 factors? Well, I think the answer is that these 5 factors have been around all along. In other words, ever since the 1980s, and that we simply have pulled them together. The symptoms in the child, the alienating behaviors, the fact that you cannot have a history of abusing the child, that all these things have been present since the 1980s. And in other words, we haven't invented something new here. We have simply pulled together the things that people have talked about forever. But I do think it's powerful to be able to say, well, we have a method You know, there's the 5-factor model. If all 5 factors are present, it's extremely likely that this child has parental alienation. So Amy and I have a little bit of a difference of opinion about whether there should be 4 factors or 5 factors. And she's already done some research on the 4 factors. See, her factors are 2, 3, 4, and 5, but I added factor 1, and I'll tell you why. Factor 1 is very basic. That if somebody's asking you, does this family manifest or does this child manifest parental alienation? The very first question you should ask is the child in fact avoiding a relationship with the other parent? Amy has a slightly different starting point. Her starting point is, we have a child who's avoiding a relationship with another parent, and then the question is this alienation or estrangement? I think that's kind of where Amy started, and so that's how she came up with the 4 things. I'm starting at a slightly different place. I'm starting at a more general question that might come up when you're doing a custody evaluation, or might even come up on a phone call when the attorney calls up and says, "Doctor, I think we have a case of parental alienation," or the father calls up. That it's an earlier point in the discussion. When the father calls up and says, "Doctor, I think my child has parental alienation," the very first question you should ask is the child coming to visit you? Is the child, in fact, avoiding a relationship? And the reason why I say that is because this concept has become so widespread that people pull it out of the air. And what happens is the mother, let's say it's the mother, is manifesting alienating behaviors. And the child is fine. But the father is, of course, concerned. And so the father says, "I think my child is getting parental alienation because there are all these alienating behaviors." It's become such a common thing to talk about that I get these phone calls. And so the very first thing you have to do is to distinguish whether the child is in fact alienated as opposed to the presence of alienating behaviors, which Jennifer has already taught us this morning. So anyway, that's why I think it's useful if you're talking to a judge, how do you make this diagnosis? I think it's useful to have factor 1. I'll tell you the other reason why I think factor 1 is useful. Factor 1 is the child manifests contact refusal. Because I think that the next thing I'm going to talk about is how do you distinguish mild, moderate, and severe? The answer to that is based on factor 1. That the level of severity of parental alienation is primarily based on the behavior of the child. And it's based on how extensive is contact refusal. So I'm going to move on. We actually have plenty of time here. Let's just see. Does anybody have any questions about this 5-factor thing, or comments, or suggestions? Yes. Yeah. Amy has already published in 2 different places the 4-factor model, which is almost the same thing. And so I quote it in our book as information. The 5-factor is we really make use of in the book that we're publishing in a couple of months. But I've brought it up in several meetings. I'm going to Ireland in a couple of months, and this is my topic. And in others, I'm pushing this idea. But this piece of paper you have right here is, in fact, the best summary of the definition of the 5-factor model, because this is going to be in the appendix of the book, and so if you want to use it as a teaching thing, this document is it. Robert.
Within the 5-factor model, do you give any weight to any particular factor? And let's say within the 17 and 8, are there any weights regarding presence or absence of a percentage of these factors?
I don't do that. Even the 17 alienating behaviors are interesting. you know, typically, well, you're never going to get all 17. Typically, you get a few. But what is interesting is some people have pointed out that you could have one alienating behavior that is used incessantly, that's used day and night. And I can't think of a good example, but denial of access to the child. You could just have that one and use it day and night, and that's enough to cause alienating behavior, or to cause parental alienation. But to answer your question, I don't have a set number. Do you have a set number? Well, that's going to be helpful if it ever gets off the ground. That creates more science. But I don't think you really need it at the present time. Right.
I think there are many alienated parents who are savvy enough at this point to make the kids go.
Right.
Let the kids spend the entire time in the room on the phone with the other parent. You know, I know a case where a child bought a duffel bag.
Right.
And it was the sheets he was going to sleep on at the mother's house, father's house, whichever. And the water he was going to drink. He was there in body, right, but not in spirit.
Right.
So it's about.
I think we're all saying that now. Avoids a relationship. Yeah. Yes, ma'am. You mean what do alienated children manifest? They still manifest. They commonly manifest the 8 symptoms: the denigration, the trivial explanation, the lack of ambivalence. Yeah.
And she has offered him up an alternative identity as a transgender person, and she goes around the shape. It's this non-binary person that she offered up as here's your offering.
Yeah. I don't know how that factors into this type of thing. Right. I think there are so many different variations. I don't know that there's a specific pattern that we can identify. Yes, ma'am. Well, that relates a little bit to mild, moderate, severe, which I want to get to. Frankly, I don't know if we can really talk about intervention or what to do about it, but maybe I can touch on that. Let me explain why I harp on this idea that we should have a general agreement on how to define mild, moderate, and severe. And what I've done with my colleagues is developed a very simple screening, a very simple way to make this distinction. And we need a simple way, which might need to be tweaked in certain situations, because we get asked this all the time. For instance, in Jennifer's research, she identifies parents, millions of them, who have the idea that there is severe parental alienation. But we have no idea what those parents think of And almost always when you actually work with parents, their perception is that their situation is much more severe than objectively it is. So let me give you my very simple definitions. They're operational definitions, meaning that you can use them without having lots and lots of detailed information. And this is on page 6. Mild means the child says, I don't want to go see daddy, but the child goes, and once he's there, he's fine. Once he gets out of the driveway of mommy's house and goes down the street, he's fine, even though he has complained about it and objected to it and told therapists he doesn't want to go see daddy. When he actually goes, he's fine. Moderate is the child says, I don't want to go see daddy, and when he goes, he's problematic. He's very negative. He stays in his room. He won't have dinner with the family. He arguments and so on. Severe is the child says, I don't want to go see daddy, and doesn't go. And daddy has not seen the child for 2 or 3 years. And that was kind of our starting point. And this was based actually on Richard Gardner. Gardner had mild, moderate, and severe. And what I just said is part of the way he made that distinction. Now, it's been pointed out to me, and we've accommodated for this, that there are in fact children who do go who are extremely severely alienated. And partly from what Amy said a couple minutes ago, that that there are children who go because the judge says you have to go, or even their mom says. I keep using gender in this way, but when they go, they're extremely negativistic, and they bring the duffel bag, they bring their own food, they stay in their room, they lock the door, they get on their cell phone and spend the entire afternoon with the alienating parent and so on. And so those kids, even though they do go, should be classified as severe. Now, why are we going to this trouble? Yes, Linda. Okay, thank you. Why do we need to have these definitions? Well, first of all, the level of severity determines what the intervention should be. That just typically mild, you can sometimes fix by simply admonishing the parents to stop doing what they're doing. Moderate, typically you need complicated multimodal family intervention or something similar, where you meet with the different parts of the family and you have a parenting coordinator under the jurisdiction of the judge and so on. Severe, you almost always have to remove the child from that parent because it's child psychological abuse. See, I'm concerned that people say causing parental alienation is child psychological abuse, and the child should be removed from that household. But that's an inaccurate statement. I think that is a correct statement for severe cases. But if you just make that blanket statement, you're misleading people, because there are mild cases and there are some moderate cases. You're not going to remove the child from that home in those cases. In other words, unless you make this distinction, you're confusing the judge. There's a whole thing about prevalence, and I came up with this idea I calculated it out, and I got about 1% of children have some degree of parental alienation, which includes the mild cases. There are many, many mild cases, fewer moderate, and very much fewer severe cases. So if you're going to talk about prevalence, you have to have clear in your mind which ones are you talking about. And if you do research, you know, on this kind of problem. You have to be able to. Oh, I know what I mentioned this yesterday when I was talking about this, that I was interviewing people who have a treatment program, and they said, you know, that their program has a certain amount of success, and this is what they do, and this is how they do it, and so on. And I said, well, what kids are appropriate for your program? And I said, mild, moderate, or severe. And they said, well, we don't know how to classify kids mild, moderate, or severe. We don't have enough information to do that. And it just seems ridiculous that if you have a treatment program, you're charging several $1,000s. You have to be able to define in a simple operational way what to do about it, or how to classify them. Now, the lady asked about what do you do with these children? I don't think parents can do it all by themselves. I think that you have to have some kind of intervention with children who come to your house and bring the duffel bag. And the intervention has to involve the alienating parent. Alienating parents are very powerful. That they spend months and years telling the child to go to dad's house, spy on him, argue with him. Well, they don't actually say that. What they say is, you have the right to have an opinion at your dad's house. They don't say go over there and argue with him. They say you're entitled to have an opinion and to express your opinion because you're 14. And the intervention has to be to influence the alienating parent, because some of these people are so powerful, they can tell the kid, stop it. You know, we've gone through the arguing now for a year, and now we've decided we're not going to do that anymore. You go visit dad this weekend, and you be nice. And the kid is nice. It's just amazing that in other words, that's evidence of how powerful the alienating parent had been all that time, all this time saying, oh, it's the kid's decision. But the alienating, at least in some cases I've seen this, that under certain duress, the alienating parent simply tells the child to be different. So my point is that in cases like that, the intervention has to involve the alienating parent, or you're not going to get anywhere. Yeah. Any thoughts on this, the mild, moderate, severe issue? Uh-huh. Well, just summarize the situation, and I'll repeat it. Situation where there's been a false allegation of abuse. So this is a bad situation when there's false allegations of abuse, and it takes 2 or 3 years to resolve it. And in the meantime, the child is getting more and more alienated. I have actually seen a good solution to that. I know once, and I'll tell you what it was, and it was brilliant on the part of the attorneys. And I realize this is not going to happen, and it's not going to help your case, but I'll tell you what happened. A mother was accused of sexually abusing 3 children, her own child and 2 others. 24 counts of child sexual abuse of these little kids who were 5 years old, maybe. They were all false allegations. And I was involved in testifying, and ultimately at the very end, she was not guilty of 24 counts of child sexual abuse. In the meantime, the sibling was placed in the custody, well, no, the kids were both placed in the custody of the dad, and one sibling was allowed to visit the grandparents every week, the mother's parents, and the mother was allowed to have visitation, supervised visitation, with both of her children, including the girl who was abused, the entire 2 years. In other words, the attorney saw this coming, and they said to the judge, if this mother is going to be found not guilty ultimately, we need to help her maintain a relationship with the victim child. It was brilliant. And at the end of the 2 years, she's found not guilty. She still had a relationship. The child was not alienated from her. I realize that's a somewhat far-fetched solution, but I'm just telling you that if attorneys who are really smart or therapists who are smart can suggest that, and you have to convince the judge to do it. And so a month or so at the end of her trial, they went back to divorce court, and the child immediately went back to living with her mom. It was fascinating. So that's maybe a response that might work in some cases. Well, I mainly just want to emphasize that I think in our writing and so on, we should try to use consistent definitions. And here's one example. Here's our proposal, the 5-factor thing and the mild, moderate, severe. There are also definitions of mild, moderate, and severe alienating behaviors. You know, that's what the mom or the dad is doing, and then mild, moderate, severe result in the child. So you have to make that distinction. Yes, sir. You get the last word. You're right, and other people say the same thing. These words were first introduced by Kelly and Johnston, I guess in 2002 or whenever that was, 2001, the reformulation paper. And they have been very helpful. I think in the discussion of this concept, the terms have been very helpful, even though we realize that they're not the dictionary definition of the terms. That they're terms of art that are used in this context. Oh, people use realistic estrangement. Lots of people say that. I mean, that's also a fairly common term. But anyway, thank you very much for your comments.